Hello everyone. In this session, I am going to discuss Iceberg Phenomenon of Disease. So basically, the diseases in the community are compared with the iceberg, and it's a very important topic from university point of view. You frequently get questions, a short question on this, where you have to describe and draw the diagram. So let's start it. So let's start the Iceberg Phenomenon of Disease. So as I told you here, the diseases present in the community, the total diseases present in a particular community, they are compared with the iceberg. Have you seen an iceberg? What is an iceberg? See, this is a real diagram of an iceberg. Can you see? In an iceberg, the unique property is that there is a little bit floating tip. Can you see? This is a little bit floating tip, and there is a large submerged portion. This is the highlighted point or main point in an iceberg you have to learn. Okay, so the floating tip is very small. It's a little bit floating tip, and there is a large, very vast, large submerged portion. You will say, ma'am, why we are comparing the diseases present in the community with an iceberg? Now, whatever diseases, say any community, say the community can be a colony, can be a city, can be a country. Say all the diseases present in a community, say India, right? So whatever the diseases are there, whatever we see, whatever is visible to us, these are the clinical cases or death, right? So that is the visible. So whatever visible to us is the clinical cases. So here the cases are there, they present, they have the symptoms, they have the sign, they run to the doctors or physicians for treatment. So that we can see. But inside the community, there is a large number, vast portion of the submerged cases, which are hidden cases. These are invisible cases. These are invisible cases because they are carrier. They are asymptomatic. They themselves don't know they have disease in them. They have infectious organism in them. Who is a carrier? Carrier is a person who feels like he is healthy. So he is apparently healthy. Actually, he is not healthy, but the person feels like he is healthy because the person don't have symptom, but the person is having infectious agent inside it. So the person is spreading it to the others, right? But the person himself or herself don't present. So that is a carrier, right? So that is hidden. Such person will not go to physician or doctor for treatment because he himself don't know that he or she is having some disease inside that, right? Now it's very difficult to catch this portion. It's very easy to catch the tip. It's very easy to catch the tip. We don't have to catch the tip. Being a doctor, the patient will come to us. The patient will have certain signs, symptoms. He will run to us, doctor, I'm having certain problem. I'm having these symptoms, these signs. Tell what is the diagnosis, what is the treatment, what is the prognosis. So whatever patients coming to us, that is the tip coming to us. But whatever patient don't come to us, right? The patient which are not coming to us, they are hidden. They are large portion which is hidden in the community. It's very difficult to catch them. So how to catch them? With the help of the screening test. The screening test is performed on a group of apparently healthy people. Okay, and on the tip which already present, we perform diagnostic tests for confirmation and we treat them. On the submerged portion, the hidden portion, we perform screening test. So whatever a clinician see, who is a clinician? Who is a clinician? The person who treats the patient. That is a clinician, the doctor, the MD, the MS, right? So doctor, whatever clinicians see in the community is the tip, right? What epidemiologists see in the community is so epidemiology is basically interested in the hidden portion. We are studying preventive medicine, PSM, preventive and social medicine. So we are interested in this portion. We want to diagnose this portion and get it treated before they present. That is the meaning of the preventive medicine. Once the patient is presenting, that will be dealt in the subject medicine. Right, so there are two medicine, preventive medicine and internal medicine. The preventive medicine is the prevention of the disease before it occurs, and the internal medicine is the treatment of the disease after it occurs. Prevention is better than cure, right? So here in PSM, we are interested in this portion, the hidden portion, right? So this is iceberg phenomenon. I hope you got it. Okay, so in the iceberg phenomenon, the diseases present in community are compared with what? They are compared with the iceberg. So you have to draw this diagram. This is an iceberg. In the iceberg, whatever you are seeing is the tip, which is very small, and it is the visible cases. Visible cases means symptomatic cases. These are symptomatic cases. And the large portion which you can't see is the submerged portion. Submerged portion, it's very vast. Okay, it's invisible. It's invisible because it is having asymptomatic cases. It can be carriers, it can be, latent cases like that. So this is the meaning. I hope you got it. Now whether you draw this diagram, whether you draw this diagram, the meaning is same. Draw one diagram. You can see this is the junction. See the tip, See the submerged portion. Here also you can appreciate this is the tip which is small. This is the submerged hidden portion which is large. Now see, what does the tip represent? Mild illness, moderate illness, severe illness, classical illness. So it's a illness, it's a disease, you know, illness. The person is aware that the person is having the disease. And see the submerged portion. These are the asymptomatic cases. Exposure without infection cases. Okay, so these are the cases, the submerged portion, and this is a junction between them. Okay, the same thing here it is shown to you. See, this is the junction. Okay, these are symptomatic cases, these are pre-symptomatic cases. So what physicians see in the community is this one, the tip, and what the physician don't see but the epidemiologist see in the community is this one, the vast submerged portion. So being an epidemiologist, the epidemiologist is more interested in the submerged portion and the clinician is more interested in the symptomatic cases, right? So same thing is shown or written. You have to write like this in your exam. What does the floating tip represent? What does the submerged portion represent? The floating tip is representing the clinical cases. It can be diagnosed cases, symptomatic cases, or clinically apparent cases. And the submerged portion is representing the hidden cases. It can be latent cases, inapparent cases, pre-symptomatic cases, undiagnosed cases, or carriers. So these are the hidden cases, right? So the epidemiologist is concerned with the hidden portion and the clinician is concerned with the tip, right? The screening test is done for the hidden portion and diagnostic test is done for the tip. You got it? So basically in your exam, draw the iceberg like this, draw the water line between here, write down this one is tip, write down this one is submerged portion, and this is the water line between them. This is submerged portion. Okay, now the tip is representing the symptomatic cases and the submerged portion is representing asymptomatic cases. Symptomatic cases can be clinical, mild, moderate, severe, classical. Okay, and the asymptomatic can be latent, can be hidden, can be carrier, like that you have to describe. The next thing you have to say, the epidemiologist is interested here in the submerged portion. Epidemiologist. The clinician is interested in the tip. Clinician. Okay, clinician. Okay, one more thing you have to say, the last thing here is that the diagnostic test is applied for the tip and the screening test is applied for the submerged portion. So please compare the diagnostic test here, screening test here. Clinician is here, epidemiologist here. This one is small, this one is large. And what does they represent? So you have to write also, you have to draw also, right? So all the diseases show iceberg phenomenon. All the diseases, all infectious diseases, they show iceberg phenomenon except 4 diseases. There are 4 diseases in which iceberg phenomenon is absent. You have to learn the name. Here all or none. Either they occur or they don't occur. They are not hidden. If someone in this world have rabies, it will present. There is no hidden case of rabies. There is no carrier. There is no latent case of rabies. If someone is having tetanus, measles or rubella, it will present. So either it will not occur or it will occur. They don't remain latent. So that's why they have the complete visible portion. They don't have submerged portion. So all the cases which are there, they are 100% visible. There is none of the case which is hidden in these diseases. They are always present. Okay, they don't have carriers. So there are 4 diseases: rabies, tetanus, measles and rubella. So please learn a mnemonic R2TM. Okay, so please learn RRTM. Okay, Rajasthan to Maharashtra, you can learn like that, or RTM. Okay, RRTM. So it's rabies, rubella, T is tetanus, M is measles. So please learn these 4 diseases. We are done with this phenomenon. So let's come on some MCQs. The first question is in front of you. Which one of the following does not represent the submerged portion in the iceberg? In the iceberg, the hidden submerged portion, what does not representing? So read the options. Is it diagnosed cases under treatment? Is it undiagnosed cases, pre-symptomatic cases, and carriers and subclinical cases? So what is not coming in this portion? They are asking for this portion. What thing is not coming? So I guess undiagnosed cases come here, pre-symptomatic also come here, carriers and subclinical also come here, but the diagnosed cases will be visible, na? They will come in the tip. So the correct answer here is A. I hope you got it. So we are done, and in the university exam you get a question on the iceberg phenomenon to draw also, to write also. Whether they are saying or not, you have to do both. You have to draw also, you have to write also. In writing, explain tip, explain submerged portion, right? In a comparative manner you can do, right? Diseases which do not show iceberg phenomenon: Rajasthan to Maharashtra, 2 times Rajasthan. So it's rabies, rubella, tetanus and measles. Please learn that. And you know the reason. They don't have carriers, they don't have subclinical case. They always present. That's all about it. Thank you.
Hello everyone. I hope you found this concept clear and easy to understand. If you had liked to dive deeper into this topic, and master it with full-length lectures, you can subscribe my app, that is MedLife by Dr. Priyanka. So join me for the live sessions where we break down the complex topics in a way that makes them simple and high yield for exams. See you inside.